Hello, I'm Betty Casey, editor of Tulsa Kids Magazine, and we partnered with the Children's Hospital at St. Francis to bring you PJ's Corner, which gives you important health information to help you in your parenting journey. All these interviews in the series are available online and in print. Just look for PJ's Corner. Today, we're talking to Katherine Bode, RD, a pediatric gastroenterology dietitian with St. Francis Health System. And she's going to talk to us about picky eating. Welcome, Katherine.
Hi, thank you.
I want to start first with you're a registered dietitian and you're a pediatric specialist. Can you briefly tell us what a pediatric gastroenterologist dietitian does? That's a big word. And also what's the difference between a registered dietitian and a nutritionist?
Yeah, so let's start with the broad. And so a registered dietitian, to be a registered dietitian, you need to be credentialed nationally and then have a state license. And so to qualify for those things, you would need a master's degree as well as a specific amount of supervised practice in each area of dietetics to qualify for that. Dietitians provide medical nutrition therapy and nutrition counseling and are qualified to treat medical conditions through those nutrition interventions. A nutritionist is not a protected title, so there are no legal requirements or certifications or license to call yourself a nutritionist. Anyone can call themselves a nutritionist. You could call yourself a nutritionist if you wanted to. And they are notably not bound by the codes of ethics or ethical codes that medical professionals are, nor are they bound by HIPAA, which is what protects our important healthcare related information. At the Pediatric Gastroenterology Clinic, we do a wide variety of things. And so I can counsel on nutrition interventions for constipation and diarrhea. I can counsel on special diets for things like celiac disease. We manage tube feeding diets as well. We do weight management as well, so just general healthy diet education. We see lots of kiddos that are having failure to grow, lots of variety of things at the GI clinic.
Okay. That's interesting, and I did not know that about a nutritionist and a dietitian, so that's great information for me, and I think for a lot of our viewers. We're going to talk about picky eating today. So can you define picky eating habits and tell us how common it is in children?
Yes. And so to define picky eating habits, there is a bit of a spectrum of picky eating habits. And so there are some age-appropriate picky eating habits that happen throughout childhood. And then we have picky eaters, and then we have problem feeders. And it can be really difficult to distinguish and identify each type of picky eater or problem feeder. And it's not necessarily a simple process either. And so for picky eaters and problem feeders, there are specific definitions. So for picky eaters, they have what is referred to as a decreased variety of foods that they eat. And so that's typically at least like 30 foods that they will eat 80 to 100% of the time that they see them. They also have food jagging behaviors. And so that's the medical term for when children love a food. They want to eat it all the time, all day long. We typically burn out on that food. And so for a picky eater, it takes about a 2-week break before we can come back to that food. And then they eat at least one food from each food group. And so think our proteins, our grains, fruits and vegetables, dairy products, as well as from each texture group. And so that is purees, that are foods that melt in our mouth. So think like a cheese puff, soft foods, wet foods, crunchy foods, chewy foods, all those kinds of things that they'll eat at least one food from each of those groups. They can also tolerate new foods on their plate. So we're not having meltdowns when there's new foods touching our foods on our plate in our area. They might even touch or taste these new foods, even if they're going to make you a little bit miserable whenever you try. They're going to complain the whole time while they do it. They'll still do it. They frequently eat different sets of foods than what family members are eating, but they will eat at the same times and in the same area as their family members. And then this is for more so for primary care providers that might be listening in, but at well child checks, they are referred to as picky eaters for several times, but less than 2 years. Okay. Um, Then problem feeders, they have more of a restricted variety of foods that they eat. So they eat less than 20 foods 80 to 100% of the time that they see them. There are entire categories of foods that they do not eat. So entire, no fruits, no vegetables, no soft foods, no wet foods. When they burn out on those foods that they're food jagging on, they don't come back to them. And so that preferred food list, or those foods that they eat all the time, keeps getting smaller and smaller. There will be meltdowns, there will be crying and screaming when new foods are involved. They just like picky eaters, they don't eat the same foods as their family members, but they also don't eat at the same time as family members, sometimes not even in the same area as family members. And their and primary care appointments are referred to as picky eaters persistently and for longer than 2 years. That was a lot of
Interesting.
information.
No, that is so interesting because I know a lot of people are confused about what picky eating is. So you mentioned there are times that children do become picky eaters, maybe briefly, that maybe it isn't problematic. Is there are there developmental ages where that might happen that parents can watch for?
Yes, yes. And so there are times as we grow up that we change essentially the way we think. And so it's cognitively our brain development changes. And so when we're babies, we are more, it's called sensory motor. And so we want to put things in our mouth, we want to touch things. As we move into the toddler phase of life, we get into more of that magical thinking. And so there's monsters in the closet, there's unicorns jumping between the clouds. Then we get into our kind of tween stage where it is black and it is white and it is yes and it is no, and these are the rules and this is what we do. And then we move into like the complex thinking of more teenagerhood, adulthood type thinking. But
Okay.
but when we are in those shifts, that is whenever that natural picky eating comes about.
Okay. Do we know what causes this? What causes picky eating or that kind of difficulty?
It's it's hard to say. And so I think we're going to talk about this a little bit more as the interview goes on, but
Yeah.
eating is really complicated. And so there are lots and lots of things that go into eating, which we'll expand on. But it's complicated. And so as far as like overall prevalence of picky eating, it's also difficult to say because our definition of picky eating has changed quite a bit over the years. And so in the research studies that we have, oftentimes there are different definitions for picky eaters, and so very broad kind of definitions too. And so as far as prevalence right now in our literature, we have a 7 to 57% chance of having picky eaters. So way wide range.
Spectrum.
Um, yeah, yeah.
Yeah. Okay. Well, we'll talk more about that. What are some common myths surrounding picky eating?
Yes, and so there are 10 big well-known myths surrounding picky eating. For the sake of time, we'll just go through a couple, and then at the end, I'll talk about where you can find out more information for that. Our first biggest myth is that eating is the body's #1 priority, and that is not true. Breathing is actually the body's #1 priority. And so if we're not breathing well, we're probably not going to eat well either. And what do we not do when we're swallowing food? We're not breathing, right? And so if we're having breathing difficulty, we're probably not going to be crazy about doing something that's going to stop us from breathing. So you might say, okay, so eating is probably the second priority of the body, right? It is not. Making sure we don't fall on our face is actually the second priority of the body. And so postural stability is the second priority, and then eating is our third priority of the body.
Interesting.
Yeah.
Eating is my #1 priority. Uh, if I see that my child has some of these issues that you're talking about, and some of these behaviors, when should I talk to my doctor? When should I be that concerned?
So really, if as we were talking about those picky eaters and problem feeders, if you feel like your child is identifying with those, we really do want to go and talk to primary care about those behaviors, especially our problem feeders. We really want to go in and talk to primary care and see if we can get a referral to either a dietitian or to a feeding therapist.
Okay. So even any kind of concern, I think you should always go to a health professional if you have questions.
Yes.
They'll help you
Yes.
out. Um, yeah, what if I want my child to try new foods? How do I go about doing that?
So the key there is that we want to convince our children to want to try new foods. And so not necessarily food specific, but we want what's called internal motivation with our children to try these new foods versus an external motivator. And so an external motivator would be like, if you eat your vegetables, I will take you to the park. If you eat these vegetables, I will give you 3 cookies after dinner. The problem is once we take away that external motivator, this child is not going to eat their vegetables. It isn't like most medical answers. It's not a simple answer, especially if we have a picky eater or a problem feeder. And so I will say a little disclaimer: if you do feel like you have a problem feeder, we don't want to change anything about their feeding behavior until we can get in and talk to primary care about those referrals to those other medical professionals. For the average child that just has a little bit of picky eating every now and then, increasing our engagement in our feeding environment and our interest in our feeding environment can go a long way before or for increasing our willingness to try new foods. And that can happen before we ever get to the table. And so to help with food planning, and so maybe we get grandma's recipe book out and we look through it and see if there's anything that sounds tasty to them to try. Maybe we make it together. Maybe we try the foods when they're raw, as long as it's safe. And maybe we try it after it's cooked. And then once we're at the table, we can have conversation at the table about that food. What do we think of it? What is the texture like? What is the taste like? So on and so forth.
Um, you know, parents worry so much about their children eating, sleeping, pooping. Those are common worries. Eating is a major one. So we want our kids to eat, and there are many brands of nutrition supplements on the market. Is a nutrition supplement a solution for picky eating?
So it's not a solution for picky eating because we don't, it doesn't replace learning how to eat, right? Just to start a nutrition supplement. I have lots of parents that come to the nutrition clinic that are worried about their children not growing well. They're concerned about the nutrition quality of their child's diet. And so that's oftentimes why they add that nutrition supplement. In specific situations, nutrition supplements are very appropriate and can definitely be helpful in providing adequate nutrition to children with feeding difficulty, but we don't want to unnecessarily add a supplement. And so especially if we again just have a regularly eating child, we don't need a supplement. We just need to increase the volume of what they eat right now, and that's going to help get us that growth. If your child can't eat adequately because you feel like they don't have a really good appetite or you feel like they get full very quickly, that's another sign we need to get into primary care and talk about those things and get those referrals.
Yeah. So I think talking to your child's pediatrician or healthcare professional would be a good approach before you try supplementing their diet, probably.
Yes. Yeah.
Um, the SOS approach to feeding, you mentioned that. What is the SOS approach to feeding?
So the SOS approach to feeding is an acronym. And so it stands for sequential oral sensory. And that is just a specific type of approach to feeding therapy. And it's designed to assess and address all factors involved in feeding difficulty. So in other words, we are treating the whole child in this approach. It is family-centered, it is child-directed. It was developed over 30 years ago by Dr. Kay Toomey, who is a child psychologist and is an effective way to assess and address problematic feeding behaviors in a variety of settings and populations. And so when we talk about getting a referral to feeding therapy, the SOS approach to feeding would be one type of feeding therapy that we could go to. They had a conference in Tulsa earlier this year, which I was able to go to, which is how I'm able to work in tandem with these feeding therapists and know so much about picky eating. But we have lots of providers in the area that are open to patients.
Great, that's great. Um, So again, talking to your healthcare professional, starting with your pediatrician, maybe getting referrals. It sounds like you work as a team to assess the
Yes.
child. The child.
Yes, yeah. So this is a multidisciplinary approach. And so that means we have parents involved, we have physicians involved, occupational therapists who are certified as feeding therapists, speech therapists as well, dietitians, and mental health professionals if it's appropriate.
What you mentioned that there are a lot of professionals available to help children in our area. What other resources are available to parents with picky eaters or problem feeders?
Yeah, and so we've talked about this throughout the interview, but your child's medical care team is a huge resource for you. And so if we're having these concerns, they can connect you with resources, they can connect you with other medical professionals that can help you with these issues. The dietitians at the GI clinic, the gastroenterology clinic, are taking new patients right now, and so we're happy to see you and have these conversations. Other resources available for you right now. So the SOS Approach to Feeding has a website. It is sosapproachtofeeding.com. They have a free 2-hour parent and caregiver workshop available. They have blogs, they have podcasts, lots of educational resources. From the SOS Approach to Feeding, this organization does a lot of research as well, and they've found that picky eaters, kids with feeding difficulty, can cause significant parental stress. And so from this organization, the organization Feeding Matters was born. Their website is feedingmatters.org. And it is a parent peer support resource for parents that have children that are picky eaters, that are problem feeders. And they also have so many resources available. They have we can talk about it all day, how many resources they have, but they have feeding questionnaires, which are really helpful. And so if you're feeling like this is your child that we're talking about, go out to their website, fill out that questionnaire, and bring it to a primary care appointment. And they have all the lingo, they have all the things they need. They also have an SOS trained provider directory. And so all providers that are trained in the SOS approach are out there. And so maybe we live outside of the Tulsa area and we don't want to drive into Tulsa once a week for feeding therapy. There might be someone closer for you available.
Oh, thank you so much. Those are great resources. And I'm glad you mentioned the parent piece of that, because I can imagine parents feel so guilty and so helpless and frustrated. So thank you for mentioning that resource as well. That's great. Thanks.
Yeah, and I would like to touch on that since we've brought it up. There have been numerous studies looking at parental causation of picky eating habits, and we have found that neither household chaos or maternal sensitivity, structuring, attending responses, encouragement, emotion, or problem-focused responses were correlated to children's food fussiness, fullness responses, slowness to eating, or food enjoyment.
So it's not the mother's fault?
Correct.
Thank you. Okay, thank you so much, Katherine. I know I learned a lot. I know our readers and viewers have learned a lot today. I also want to thank the Children's Hospital at St. Francis. Again, look for PJ's Corner in Tulsa Kids Magazine and on our website for this interview and much more health information from the Children's Hospital at St. Francis. We so appreciate you. Thank you so much.